I was seeing patients in a co-located clinic with obstetric providers, and I would see them as a psychiatrist. And I remember one person presented to me, and she described her experience in her first pregnancy. She presented in her second pregnancy, and she described that she felt like the baby was born, and the baby felt like an alien to her. She described that she was in a black hole for a year, and she had no idea that she had depression. And it wasn't until she came out of it that she realized that she wasn't herself. And there was a few things that struck me about this. One, she was extremely depressed. She had no idea. Two, no one asked her about it. She was seen in obstetric settings. She was seen in pediatric settings. And nobody asked her about her mental health. Nobody mentioned mental health. And there was many opportunities to treat her. And her baby suffered unnecessarily. And while that was happening, there was months wait for people to see me. And the OBs would come over to me in my office and they'd say, we don't know what to do. Like, we want to help, but we don't know how. So I thought there has to be a better way. And so we did focus groups with patients with lived experience and with providers, and we asked them, how can we do this better? Like, how can we help integrate mental health care into OB settings? And we heard from both of them that they wanted a lifeline. The OB said, we don't know what to do. We want to help. We don't know how. And the patient said, RPs don't know what to do. We want them to help. They don't know how. And so we created this model of care by what we do is we build the capacity of obstetric settings and perinatal care settings more broadly to address mental health care themselves. There'll never be enough psychiatrists or mental health providers to see the individuals that need one, as we all know. And so what we do is we help them do that. And we do that through in three core ways. One is we do trainings and toolkits. We provide trainings at OB practices, and we do grand rounds at birthing hospitals. We also provide consultations. So if an obstetric provider is seeing a patient and they're not sure what to do, the patient screens positive or they present with a mental health concern, they can call us. They can speak with one of our perinatal psychiatrists, and we'll hold their hand and help them manage that situation and respond adequately. And then we also can see that person for a one-time consultation. So we can see them typically within a couple of weeks. And this is a statewide program available to anybody in Massachusetts. So any perinatal individual in Massachusetts can access mental health care in that any of their obstetric providers can call us, and we can help their obstetric providers provide mental health care. And then the third thing we do is we provide resource and referral. So we help the patients and the providers that serve them navigate what we all know is a very complicated mental health system. We've served thousands of women over the years, and it's funded by the state. We provide this, the budget's $1 million, and because we provide this care for the whole state with a limited amount of funding, it's very quickly became a national model of care, which is exciting.